Esteemed audience, it is better to debate a matter without settling it
than to settle a matter without debating it.
Indeed, and so we are here at the Great Debaters Contest, the home of the best debates in high school. I am your host, Esperancia Kapanga.
And I am Chris Boru. The bone of contention between our intellectual teams today is Africa should be the hub of implementing new drugs and health policies.
In the proposition, we have the gentlemen from Malava Boys High School.
And in the opposition, we have the ladies from St. Martha Mwitoti School. Proposal number 1, you have 3 minutes to make your submissions.
Okay, Article 43(1)(a) of the Kenyan Constitution states that right to health care is a fundamental human right. I'm Jamal Shaban from Malava Boys High School, here to propose the motion, Africa should be the hub of implementing new drugs and health policies. I'm going to start by defining the key terms in the motion. According to Oxford Dictionary, a hub is the central and most important part of a particular place or activity. Implementing, this is to make something that has been officially decided to start or happen. And according to Wikipedia, health policies are discussions, plans, and actions undertaken to achieve specific healthcare goals within a society. A quote from Hugh Leonard said that 3 things cannot be long hidden. That's the sun, the moon, and the truth. Better health will enable children to learn and others to earn. That's according to World Health Organization Country Strategy publication from 2017 to 2025. According to the UN Health Report in the year 2015, approximately 1.6 million Africans, you can imagine, 1.6 million Africans succumb to diseases such as TB, malaria, and other diseases, in that violating Millennium Development Goal number 8, which its main aim is to combat malaria, HIV and AIDS, and other diseases. I strongly propose that Africa should become the hub of implementing new drugs. Why do I say this? As per the UN report, Africa is plagued with many diseases. So if it becomes the hub of implementing new drugs and health policies, this may tend to reduce the number of deaths to such, and also new health policies will be implemented. For example, policies like tobacco control policy, reproduction health policy for the youth, and vaccination policies. Will this not reduce the rates of death in Africa? Secondly, if we implement new drugs and health policies, this will guide on planning, standardization, and implementation, monitoring, and evaluation of health services provided by the government, non-governmental organizations, faith-based organizations, community-based organizations. So, if Africa becomes the hub of implementing such health policies and drugs, some of the benefits that we might get from the implementation of these policies are vaccination policy, tobacco control policy, and productive health policy for the youth will be put up in helping numerous groups. But if Africa doesn't become the hub of implementing health policies, what policies are then going to be used to run the programs? So health is the main key. Thank you. I rest my case.
First proposer, you have 3 minutes to make a statement.
The name is Danton Macau from St. Martha's Mwitoti, Center of Excellence. I am here to play antagonist for the motion that states Africa should be the hub of implementing new drugs and health policies. Now, I wake up one morning, find you inside a class teaching 5th graders calculus and algorithms and complex mathematics. I smile and you smile back to me. It's a cross purpose. You probably think that I'm smiling because I'm happy of your uptight mood, and that is not the case. I am smiling because I am laughing at you. Why are you corrupting these kids with this knowledge? They are not ready. Listen to yourself. A 5th grader, calculus? Really? So Africa is not ready to become a hub. Rather, let us have it implement this, but not become the hub. Evidence. Lack of personnel. Now, Africa has failed to uphold the SDG goal number 4 of providing quality education. This has led to lack of qualified personnel. 2% of the doctors in the world are from Africa. Africa is a 56-based continent, 56 countries. Now, With 2% of doctors in the whole of Africa, subdividing it to 56 countries is a problem. Now, lack of personnel. This is due to brain drain, poor motivation, and corruption. So, if we need to make Africa the hub, we need to uphold the personnel. We need to create better training facilities so that we might have more qualified personnel. Until then, Africa is not ready to even handle its own status of health. Why make it a hub? That is impossible. Come on, I would be absurd to claim Africa becoming a hub. Well, I would be chauvinistic, maybe, because Africa is my country, but I am not going to be chauvinistic. Africa is not ready. We lack infrastructure, and the infrastructure that is available is not developed. We even have unstable electricity in our continent. That is a touche. I mean, the health centers, the ones that are available, are of poor and filthy case. So making us a hub, we need to implement this policy, yet we have the poorest infrastructure. How are we going to manage this? You're looking at me, members of the audience, you look surprised. Same up here. I am surprised. We are not ready to become a hub. If we want this to happen, let us build on our infrastructure. Let the government in each country uphold the policy on poverty. Once we develop our infrastructure, get the personnel, we will be ready to become a hub. Until then, as Danton Macau, Africa is not ready to become a hub for implementing the new drugs and health policies. Thank you.
Second proposer, you have 3 minutes for rebuttal.
Nothing is impossible. The word itself says, I'm possible. Okini Steve Odhiambo from Malava Boys, ready to strongly propose the motion that states that Africa should be the hub of implementing new drugs and health policy. Why do I say so? On to my first point. Africa is a working continent. And remember, a working continent contains working nations. And working nations are made of working bodies. So, if the health is in a bad situation, there's no way you'll want Africa to be the best and the health is in a bad situation. According to www.who.com, new health policies will enable the workforce to reduce poverty, hunger, and environmental degradation. Take, for example, the policy of health quality policy. Remember, the health quality policy goes hand in hand with gender equality. And if you have the best health quality policy, we'll have the best gender equality in the country. I narrow down to Kenya. Kenya, according to www.worldmeters.com, Kenya is a country which mostly comprises of civil servants and farmers. And these civil servants and farmers are the breadwinners for their families. Remember, they're the wage-earning group in our country. And it said that most of the civil servants and farmers in Kenya mostly succumb to death due to health issues. What about if we can come together, bring our minds together, and implement these new drugs and health policy? I'm sure we'll boost our economy up by boosting our labor. On to my second point. While Africa is a continent of rich natural resources, remember, Africa is poor in human resource. Africa faces a dire shortage of doctors and nurses. Working conditions sometimes are harsh and some are thankless. And those has led to system shocks such as Ebola in Uganda. The other day we just heard there was an Ebola outbreak in Uganda. And this has led to a mass loss of lives. With the above things, I strongly believe that if we come together as Africa and implement these new drugs and health policies, we are going to make Africa be one of the best continents in the entire world. I truly believe that Africa should and can be the center of implementing new drugs and health policies. Remember, optimism is the faith that leads to achievement, and nothing cannot be done without hope and confidence. My fellow Africans, let us believe and trust in the philosopher Barack Obama when he sat down and said, yes, we can. I believe, yes, we can make Africa the hub of implementing new drugs and health policies. I believe. Remember, without good health, nothing grows, but everything wins. I rest my case.
Second opposer, you have 3 minutes for rebuttal.
Muhanyi Charity, St. Martha's Mwitoti, here to oppose the motion that Africa should be the hub of implementing new drugs and health policies. Now, did you just say that it is possible to implement these policies in Africa? Surely no. Look at this, the universal health coverage. Kenya itself has failed to fight corruption. Take a look at Somali. There is anarchy in Somali. Yet you stand here saying that yes, we can. Yes, at some point we can. But we can if only we manage to fight corruption in our own countries. My point is, weak governance and rampant corruption. The phenomenon of ghost workers has remained unaddressed. Counties have become new dens of corruption. Today, day in, day out, the talk of the day is corruption, corruption, corruption. Tell me, my friends, how have these policies been going to be implemented? How is Africa been going to be made the focal points in implementing new drugs and health policies if corruption is not fought? Take a look at this. Government and health officials are the ones in the looting spree. Then, how is this going to be implemented? Unless measures are taken, unless such penalties are given to these people, then this is going to be a tale of the past. My audience, it is evident, use of counterfeit drugs in African countries. According to a report by the World Health Organization, 25% of drugs in Africa are either substandard or counterfeit. It is evident. You see it even in our hospitals today. There is theft of medicines and supplies. That is evident in our hospitals today. Overbilling. NHIF, the National Health Insurance Fund, recently complained of being overbilled. Take a case of one Faith Mbeyu, who had to pay 45 million for her bills. Are you sure NHIF will cater for this one Faith Mbeyu and then come and cater for other people? Surely it will be impossible. There is limited community participation in planning, management, and monitoring of health facilities. Unless our community is involved in this, then surely this is never going to take place. Most reforms in Africa, for instance, are political. They come and go with regimes. Political instability in our African countries. Take a look at Somalia, anarchy daily. Take a look at South Sudan. How are we going to be made the hub of implementing new drugs and health policies? Yet, there is political instability in our own countries. Are you sure there is anyone who's going to risk his or her life to become a doctor in our nation? Yet, we are politically unstable? Surely, no, my audience. To solve this, there should be training facilities and harsh penalties should be taken against perpetrators. I sum it up with these quotes by J. Christoph. Each of you might decide where you stand. All we ask is that you refuse to kneel. You are the people. You have the power. Open your eyes. Open your minds. Then cross your fingers on your hand. If only the community is going to help us, then we are going to ensure that Africa is the hub. But if not, it will be a tale of the past. Thank you.
For the question session, the proposers have been asked, is Africa really in a good financial position to support this hub that they're suggesting for health policy making and new drug development? The opposers, on the other hand, have been asked, they gave a case in point where one patient requires 45 million from NHIF for their hospital bill, but now they're being asked to make a comparison between that 45 million and the total amount of money that NHIF collects from all the people who've subscribed to the service. Is it really that significant? Proposer number 3, you have 3 minutes to respond.
First of all, I would like to answer the opposer who posed a question to me. Do you think that Africa is in a good position for being the hub? Of course not, because health goes hand in hand with all the SGDs. And there is no way we will be well financially minus good health. Africa should be the hub of implementing new drugs and health policies. According to the World Health Organization country development strategy of 2017 to 2015 states that better health will enable the workforce to be able to reduce poverty and hunger. Many Africans are submerged in poverty because of the indiscriminate diseases which can be vaccinated or even prevented. But in Africa, we lack the good drugs and the policies. With good policies, Africa will increase public service for delivery of health service, and in addition, Africa will be a healthy continent, isn't it? Such policies as vaccination policy, breastfeeding promotion policy, pharmaceutical policy will reduce the amount of counterfeit drugs in Africa. On to my second point. The health of all Africans will be enhanced by increasing the equitable access to health services by improving the quality, efficiency, and effectiveness of the services at all levels. More so, the vulnerable persons, e.g. the adolescents. We need it most because we are the ones who suffer from STDs and STIs, including HIV and AIDS. With good policies, we can fight the diseases and we can know how to prevent them better. With good policies, African countries will increase public service for the delivery of health service. And in addition, as I said before, will be a healthy continent. I'd like to conclude with this point. Africa is blessed with enormous resources, and it is estimated to contain 40 to 45 species of plant with a potential for development, and out of which 5,000 species are used medicinally. But unfortunately, only 2% of the drugs used in Africa are produced internally. This according to Hindawi. Africa should be a hub of implementing new drugs, and beside the easily available raw material because of the 5,000 species, it will also be a source of earning income for the poor Africans. And that's the reason I really support the motion that Africa should be the hub of implementing new policies, new drugs, and policies. Thank you.
Third opposer, you have 3 minutes to respond.
Do you really understand what being a hub means? Do you really understand what being the center point of something, the focal point of an activity means? If you are the focal point of an activity, you must be stable, both economically, socially, politically. So I liken Africa to a toddler. He must be taught everything. He must be taught to eat. He must be taught to walk. You can't force him to run when his time is not yet. So, by making Africa the hub or the focal point of implementing new drugs and health policies, we'll be forcing Africans to run. Yet, they have not reached the stage of running. Now, to answer that question, you asked us to compare the 45 million per person and what the NHIF cover takes annually. Let's look at this. This is a national cover. Every individual, almost every individual, let's say about 70% of Kenyans are using this cover to cover for their health services. Let's take the example. A normal mwananchi, that's a civil servant, has to pay 500 shillings towards the cover. This amount collected can amount to that 45 million. And over the years, this 45 million can be exaggerated. Remember, this is a corruption country. This amount can be exaggerated. And when it's exaggerated, people tend to do it just because they want to gain out of it. On to my first point. By making Africa the hub of implementing new drugs and health policies, consider this. African countries has high dependency on loans and donations. Let's take a look at Kenya. Kenya's current public debt stands at a whopping 4.2 trillion. 4.2 trillion, just imagine that. Hey, that's a lot of money. If We are now at an economic crisis. We are unable to borrow. We are unable to run our projects. President Uhuru recently has been forced to stop ongoing projects to stop new projects so that the ongoing projects can be fast implemented and finished. Thus, the new projects will come in. Let's take the example of Somalia. Somalia is highly dependent on donations and food aid. Somalia's current situation is insecurity. The insecurity has prompted the government of Somalia to borrow money so that it can at least stabilize, so that at least it can get a face in the African continent. It's evident that Africa is good at adopting agreements and taking numerous decisions, but very bad at implementation. This is according to Mangeni, the Director of Trade and Customs at the COMESA Secretariat. Why would this guy say this? This is because most African countries are unable. They are dependent on the donors for foreign aid. They are dependent on the donors for food aid. Now, take this example. You have a guitar. You can't give an experienced person a guitar to strum it. You'll get an illogical tune. But give that guitar to a person who is adapted to it. He'll give you a very good tune. Thank you.
Proposers, you have 1 minute for your final submission.
Once again, Jamal Shaban, Malava Boys High School. The opposers have told us that a toddler should be taught to eat, to work, and everything to do. Thinking critically. If a toddler is unhealthy, will he be able to be taught? No. And, for example, I'm an engineer. I'm supposed to go and construct a road somewhere. I'm sick. Will I be able to go and construct the road? No. So, with good health policies, African countries will realize decline of under 5 mortality, deaths of children from vaccine-preventable illness will decline, HIV spread will be reversed, adolescent and maternal health will be catered for, and Africa will be a healthy continent. Hence, productive and our goal of mind. Just imagine. Thank you. Rest my case.
Opposers, you have 1 minute for a final submission.
I sound phlegmatic, but I have a big phobia. Now, I sat there in oblivion, but I bumped into a statement with a fine speech saying, Africa should be made a hub of implementing new drugs and health policies. Quite boring, I think. So, members of the audience, do you know what I think about this? We are saying, yes, let the implementation come, but we are not ready to become the hub. Okay, you are an engineer, as you said. You're sick. But I am fighting for you to be implemented so that you might get that health coverage. But I am not to the point that I will let you become the scapegoat once we fail being made a hub. I do not want us to be made a hub, for we will be scapegoats to this. Evidence. Nigeria is a country that is very corrupt. Corrupt that you'll have to bribe a shopkeeper just to buy a loaf of bread from his own shop. South Africa's xenophobia. Somali is in anarchy. Zimbabwe, out of ignorance of the previous presidents, it is now suffering poverty. And Kenya, crisis in economy. Seriously, do you think with all that negative reputation on our African continent, we are ready to become a hub? Impossible. Thank you.
I noted a lot of reading from Malava boys. You were not addressing us, and probably to both teams, let me say this now that I've thought about it, always address the bench and the audience, okay? Not each other, address the bench and the audience at any given time. So we expect you to address us, not come with a book or a piece of paper and read all through, okay? So we need that eye contact, talk to us. I noted that. And then the last speaker, John, probably brought out what we were looking for all along, okay? We've been looking for the fact that Africa has the resources and the prevailing conditions for us to have them be the hub of implementation of these new policies and new drugs. You brought it at the end. The first two speakers never brought that quite clearly. But good job for doing that, because we were almost faulting you for that. You saved your team. Very good.
To St. Martha, Danton, I think Danton, you stood out for me. You are a good speaker and maintain that pace as well, and a good reasoner. From the facts of how, of our global ratio in terms of doctors' percentages, the submissions were excellent. Charity as well, good submissions. Just take note of what my colleague judge has said. But I like the submissions of corruption, theft, fake drugs, and all that, and even your passion. Okay, so keep up that as well. Kenneth. Good reasoning. I think I love your reasoning. There was a way you reasoned with us in a way that we could understand, the toddler example and all that. That was very commendable. Good at making and not implementing. I remember that statement of in reference to Africa. So all the best to both teams. We listen through.
Malava Boys High School. The judges saw it fit to award you 65%. Let's give them a round of applause. St. Martha Mwitoti Secondary School. The judges awarded you 68%. Let's give them a round of applause. Congratulations to St. Martha Mwitoti Secondary School for being the greater debater in this debate.
Indeed, we'd also like to appreciate every other school that participates in this debate, the principals and the patrons who make sure that the students get here. Thank you very much. For you at home, keep our conversation going. The hashtag is always GDC for SDGs. I have been your host, Esperanza Kapanga.
And until the next episode, I've been Chris Boru. Stay tuned.